Hi, my name is Monique Quinn-Beach. My student number is 17803524 and I'm a student registered nurse for the UWS Western Sydney, and this is my PPE2 clinical handover for a incident that happened at an Nepean emergency. And I'm communicating this to update staff on the patient's current condition and what has happened to this patient. So we took over the care of the patient at 15:25 hours. The patient is a 35-year-old male, presented to ED with sudden loss of consciousness while walking his dog. Patient received a small abrasion to the right side of his face and right knuckles, and patient is known to paramedics and staff as a history of type 1 diabetes mellitus, and is often hospitalized due to frequent bouts of uncontrolled hypoglycemia. The BSL of the patient is taken in the ambulance. That was 1.4 millimoles per litre. Patient is conscious on arrival with a GCS of 13. The patient is disorientated, so he doesn't know where he is or why, but he also responds to verbal commands by opening his eyes. BSL on arrival is 15:25 is 1.2 millimoles, so it's declining. Patient is given 125 ml apple juice to raise BSL. Continued monitoring of BSL every 15 minutes for any change. As per attending MO orders, the patient was ordered a 1000 ml bag of dextrose 5% solution to be started at 15:40 hours. As per diabetic protocol, so what they wanted to do was titrate it between the dextrose and normal saline, to continually rise his blood sugar level, but slowly, so not too quickly, otherwise it could go into hyperglycemia. Currently the patient is sitting upright. His BSL is taken again at 15:30 at 1.4 millimoles per litre. The IV dextrose titration was commenced at 15:40 hours APP, so as per protocol. Continued monitoring BSL every 15 minutes for any change in current condition. So the problem is that the patient isn't continuously monitoring his blood sugar levels, and he's letting them get too low, especially with exercise like walking his dog. The patient may not care about his condition, so he might need some sort of encouragement or a visit from a social worker or a counsellor to see if there's anything that he can do about his current condition. And in this situation, what should be done to correct it is the patient needs to have education. So he needs to understand the problems around diabetes and how it can affect everything in his life, especially his feet, his circulation, his consciousness, everything like that. It can affect it. So he needs the education, probably again because he's had this a long time, to be able to correct it. And to make him stable, we need to bring up his blood sugar levels within a normal range, and to do it slowly, so not too quickly, otherwise it could potentially be hazardous for the patient. Okay, that's my clinical handover. Thank you.